In the medical world, we have a term for nightmare scenarios. We call them spillover events. It's that precise moment when a virus jumps from the wild directly into the human population. Usually, these events happen in remote jungles or crowded wet markets. They don't happen on $10,000 a head luxury expedition cruises. I'm Dr. Megan Foster, and today we need to talk about the MV Hondius. Currently, this vessel is floating off the coast of the Canary Islands, Spain. It's not a vacation ship anymore. It's a 176-metre steel cage. On board, 149 passengers, including Americans, Europeans, and 5 Ukrainians, are living through a script that feels like a Hollywood thriller. But the threat is very real. It's called Hantavirus. 3 people are already dead. And the question the World Health Organization is desperately trying to answer is, has the virus finally learned how to travel from person to person? Before we get into the chaos on the ship, we need to understand the enemy. To most Americans, hantavirus is something you hear about in the rural Southwest. We call it Hantavirus pulmonary syndrome, or HPS. In nature, it lives in rodents, specifically deer mice. They shed the virus in their saliva, urine, and droppings. When a human inhales dust contaminated by these droppings, the virus enters the lungs. And here is where it gets clinical. Hantavirus doesn't just give you a cough. It attacks the very lining of your blood vessels. It causes what we call Capillary Leak Syndrome. Your blood vessels become porous, like a sieve, and fluid begins to flood your lungs. You essentially drown from the inside out while lying in a hospital bed. Let's look at the numbers. The seasonal flu has a mortality rate of about 0.1%. COVID-19, at its peak, was around 1 to 2%. Hantavirus, it kills up to 38% of the people it infects. That is nearly 4 out of 10 people. There is no vaccine. There is no specific antiviral treatment. We can only offer supportive care, ventilators, and hope. So, when an outbreak happens in a confined space like a cruise ship, every medical alarm in the world starts ringing at once. The MV Hondius is an ice-strengthened vessel. It's built for the Arctic and Antarctica. It's clean, modern, and highly regulated. This isn't a place where you expect to find a rodent infestation. Yet, as the ship moved through the Atlantic toward Africa, the first passenger collapsed. At first, the ship's medical team thought it was severe seasickness or perhaps a bad case of pneumonia. But then, the fever didn't break. The oxygen levels plummeted. Then the second person fell. Then the third. By the time the ship reached the coast of Africa, the ship's own doctor, the person meant to save everyone else, was symptomatic and in critical condition. This created a diplomatic nightmare. No port wanted to be the gateway for a high-mortality virus. For days, the Hondius was a pariah. This is where the tension reached a breaking point. Imagine being a passenger. Perhaps you're a retired couple from Seattle or a young traveller from Kyiv. You are trapped in a 200-square-foot cabin, listening to the sound of medical helicopters hovering outside, knowing that a virus with a 38% kill rate is circulating through the ventilation system. Now, we have to talk about the P word, pandemic potential. Historically, hantavirus is a dead-end virus. That means if I get it from a mouse, I can't give it to you. The virus isn't built to survive the jump from human to human. But viruses are biological machines. They exist to mutate. In 1996, in the Andes region of South America, we saw the first evidence of a strain called Andes virus that could move between people. It was limited, but it was a warning. If the outbreak on the Hondius is confirmed as human to human, the global medical protocol changes instantly. This is why the Spanish government and the WHO didn't just ask the ship to dock, they treated it like a bioweapon arrival. Spain finally allowed the ship to dock in the Canary Islands. But look at how they did it. They didn't use a standard pier. They created a sterile corridor. Passengers were moved in individual biocontainment units, essentially plastic bubbles with filtered air. They are being held in negative pressure rooms. This is the highest level of quarantine possible. As a doctor, when I see this level of protective equipment, it tells me that the authorities are not taking any chances. They are operating on the assumption that this virus is airborne. We often talk about these things in terms of statistics and biology, but let's remember the human element. There are 149 people in those pods right now. Among them are 5 Ukrainians who have already survived the trauma of war, only to find themselves in the middle of a biological crisis in the Atlantic. There are Americans who were just looking for an adventure of a lifetime. The next 72 hours are the most critical. This is the genomic window. Laboratories in Madrid are currently sequencing the viral DNA from the victims. They are looking for specific mutations in the S segment of the virus, the part that controls how it attaches to human cells. If they find that the virus has evolved a high affinity for human lung tissue, we are looking at a global health emergency. The good news: modern science is faster than it was in 2020. We have the technology to map this virus in hours, not weeks. But the bad news is that Hantavirus moves fast. It doesn't give you weeks to recover, it gives you days. So, what is the takeaway? Is this the start of a new pandemic? My professional opinion? Not yet. We have the ship contained, we have the passengers isolated. The Spanish government's heavy-handed approach is exactly what we need to prevent a localized outbreak from becoming a global disaster. However, the MV Hondius is a wake-up call. As we push further into remote areas, and as our climate shifts, these spillover events will become more frequent. We cannot afford to be reactive. We have to be proactive. I will be following the lab results from Madrid very closely. As soon as we have the genomic sequencing data, I will post an update here. If you want to understand the science behind these headlines without the sensationalism, I encourage you to subscribe and stay tuned. For now, our thoughts are with the families of the 3 victims and the passengers still in isolation. This is Dr. Megan Foster. Stay informed, stay healthy, and look out for one another.